Indonesia faces a significant increase of the population of chronic disease every year. Based on data from the International Diabetic Federation 2021, there are 10.7 million cases of diabetes, with 35% of them at the risk of experiencing chronic wound problems. Apart from that, the Global Cancer Observatory explained that in 2022, there will be 35,669 cases of colorectal cancer. Looking at this data, the need for nursing specializing in wound, stoma, and incontinence care is very important. Currently, the number of nurses who have this specialty is still very limited. Only more than 200 graduates have been recognized by WCET since 2005 in Indonesia. This figure is not comparable with the increase in the number of patients with the colorectal cancer, diabetes, and incontinence. To answer this challenge, the Corporate University of Wocare Indonesia presents the Indonesian Enterostomal Therapy Nurse Education Program, which has been accredited by the World Council of Enterostomal Therapists. This program is designed to produce health workers who are competent in treating wound, stoma, and incontinence patients to a comprehensive, competency-based curriculum. The Corporate University of Wocare Indonesia provides facilities to support students' learning experience. Let's take a look at our learning facilities.
To start this virtual tour, let's see our library and discussion room. In these library rooms, we have discussions seats where students can discuss and read the books in here. We are going to see our collections in this library. We have many international journals, from journal close incision negative wound therapy and until to journal of wound care. All of these journals are very up to date, so we have so many of the titles here. And then there are books of wound care here, and also books of nursing care, and also books of cancer care. And this is specifically designed for the most up-to-date wound care books. Now let's see our continence book here. We have so many titles from international publishers about wound and ostomy and continence care here. And also these sections is specifically dedicated for ostomy books. Apart from the e-libraries that we have, our Indonesian Enterostomal Therapy Nurse Education Program students also have an access that provided by our governments to e-databases such as EBSCOhost, Springer Natures, Science Direct, and Progress. So they can access so many up-to-date international publications through these e-resources provided by Indonesian government. The second room tour is our laboratory. Let's take a look inside. We divided our laboratory into wound, ostomy, and continence sections. So as you can see, this is the stoma sections. We have labeled any equipment that we use to teach the students. So this is the example or sample of the stoma appliances that we show to the students for workshops, and any other equipments that we use for workshops. We label each of them into sections too. And then this one is continence sections. It's same with the stoma sections. We label each box with the name of the equipment inside we use for workshops. We specifically dedicated these sections to wound care management. As you can see, we have so many dressings in the box that we label. Each up-to-date dressings that we use to teach students wound care management skill through workshops and demonstrations. In this sections, we dedicated for phantom or any other hard equipments that we use to teach the students and doing demonstrations to the students. And as you can see here, so we have an ostomy dolls which was made by our students and also our ostomates to teach for pediatric patients. As you can see here. Well, as you can see in these sections, there are so many phantoms with a human shapes who have ostomy. So we use this phantom to teach the students about stomach complications such as high output ostomy or any other skin problems, and teach them how to appropriately use stomach bag or apply stomach bag to the patients. This is our modification, so we modified this phantom so it can excrete the fluids from the stomach. Now welcome to our classrooms. So this is the facilities we have in our classrooms. We have the chair and desks where the students can sit and learn. And then we have this backdrop for students' graduations. And we have this very big screen TV. This is where we display audio-visual materials for teaching and learning. However, we also have this little whiteboard where the facilitators can give more explanations about what they are teaching to the students. And also it also facilitates the students' interactive learning because they could come to the front and present what they learned in this whiteboard. And also we have this IT spot here where the facilitators could put their laptop or any other materials in this chair and desks. Well, these facilities are facilitating the students and facilitators to do interactive teaching and learning process before they are going to the clinical. Now welcome to the VIP rooms and the discussion rooms. Let's take a look. Here we have the chair and also the desks where the VIP persons could do the discussion or meeting, but we also use this for the students' discussions because we facilitate this room with big screens for presentations and also show and display audio-visual materials. In here, we have the statistics of our students and training progress throughout the years. For example, we have the statistic of IT nurse graduates since 2007 to 2023, and then evaluations of the participant satisfactions with the organizations of the training. And also we have a statistic of our alumni. Now let's see the program of our alumni. We have the ostomy planner here, and then bulletin, and then many other projects for wound ostomy and continence in Indonesia. So this is the works that our alumni and Wocare are doing in collaborations. Now welcome to our coffee break lounge. In here, we have the pictures of our facilitators from many parts of Indonesia. They gave teaching in wound ostomy and continence program at Corporate University of Wocare Indonesia. This is the coffee break corner, and here is where we put the schedules so the training or participant or the students could see what is going on the day of trainings. And we have so many certificates of Mrs. Widasari Srigitarja, the founder of Corporate University of Wocare Indonesia, from many organizers and parties. If you could see here, this is thought of our Hall of Fame, where many our international visitors give their opinions about Corporate University of Wocare Indonesia. And I specifically want to mention that Mrs. Carol Stott herself has give the opinions of Wocare in this wall. Thank you for joining our virtual tour of Indonesian Enterostomal Therapy Nurse Education Program facilities. Bye-bye!
Independent practice area in the city of Bogor with home care, hospital visit, and outpatient service. Practice area in collaborating hospitals in the city of Bogor and surrounding areas, both public and private. Accommodation for 2 months. A wound care community that collaborates with community health centers throughout the city of Bogor. By attending InETNEP training, we hope that nurses can provide more effective, holistic, and evidence-based care to patients to improve their quality of life and reduce associated complications related to wound, stoma, and incontinence. Apart from that, we hope that you can open independent practice in various parts of the country in the area where you came from. The implementation of this program also contributes to advancing nursing practice standards in Indonesia, in line with global developments in the health sector.